Hi, this is Dr. Padda, Center for Interventional Pain Management, and I thought I'd clear up some confusion because I get this question all the time. I have patients that come in and they have sciatica. They have pain that goes down their leg, and they have burning, they have tingling, and they have aching. Sometimes they have this leg pain and they have pain perhaps in their foot or perhaps in the side of their leg, but they don't even have any back pain. And they ask me, well, how is it that it comes from my back? And so that's what I wanted to discuss today. The thing is that your spinal cord runs behind your vertebral body. And so this is where the spinal cord would be running. This is the vertebral body. This is a side view. And so your stomach would be out here and your back is here. When the spinal cord runs back behind the vertebral body, anything that pinches it and pinches the cord will cause pain down the leg. And so if you get a pinch up here, your pain might be represented down here. And that's the issue. The thing is, there's more than one reason why someone can get sciatica though. You can get an impingement of nerve right overlying your hip, and we call that piriformis syndrome, and it mimics sciatica. The sciatic nerve gets entrapped in the piriformis muscle, and sometimes it mimics the sciatic symptom. Sometimes it can be stenosis that's really bad, but it's not enough to compress any of the nerves. The reason why is because your spinal cord terminates up relatively high, and the stenosis may not be the cause of your symptom. It may be something on the side, something like a pinch or in a joint. And so you may not even have necessarily a massive amount of nerve compression. It may be off to the side causing your symptom. So it's the compressed spinal nerve that causes the radicular pain. And so I know that that can be confusing for patients. And then frequently I also get the comment, well, I've been told that I have degenerative disc disease. But doesn't everybody have degenerative disc disease? The vast majority of patients have degenerative disc disease. And certainly, if you got an MRI on a bunch of patients, or you got a CT scan on a bunch of patients that didn't have any symptoms, they would all have degenerative disc disease. But if you get MRIs or CTs on people that do have symptoms, that's a whole different set of studies. And that would suggest to you that you can identify the cause of a patient's pain by looking at their CT or MRI. Just because you have degenerative disc disease does not mean you will have pain, and that's critically important. And if you do have pain, you do need to take a look at a CT or MRI to get a better definition of what's going on and what is causing it. Do you have degenerative disc? Do you have a bulging disc? Do you have a herniated disc? Is your disc thinned out? Has something happened back in the facet joint or that's causing an impingement? Or do you even have maybe perhaps a piriformis syndrome, which is more a muscular problem?